Good morning, good afternoon, good evening, everyone. Today we are going to go through care delegation by RNs. This is for the NCLEX preparing RNs. So delegation is transferring tasks and their performance to a person who is licensed or allowed to perform that task, but you retain accountability through supervision. When you're delegating, you must understand that the person is agreeable to the task. You can't force a task on somebody, especially if they tell you that for sure they don't feel competent to take up that task. And then the task should be clear. What are you delegating? Is it suitable for that particular individual as per the policies? Yeah, and the scenario and the circumstances. How is the person that you're delegating this task to? Are they overwhelmed with other tasks? Are they available to have another task added to what they are doing? Communication must be very, very clear. Make sure there's a loop kind of communication whereby you make sure that the person you're delegating to this task really understands what they're supposed to do, because this will um, make sure that the task is done appropriately. Then you don't delegate and forget about it. You monitor and evaluate. So remember that we have the rights of delegation, the right task, the right person, the right communication channel. Make sure it is clear and there's a feedback to that, and the needs of that particular task and the scenario, and clear loop communication. Very, very important. Do not delegate the initial full assessment. That is your work as an RN. Why? Because you need to know the baseline that you are working with moving forward for your easily evaluation and a reassessment. Clinical judgment, don't take that from somebody else. Do it yourself. Uh, Check the basics of your patient, make a clinical judgment, and design a plan of care. And then the initial patient education, that is your mandate as an RN. The LPN can just reinforce what you've done, but that is your mandate. Evaluation and your assessment, very, very important. Use your initial assessment, baseline clinical judgment data, and evaluate and reassess this patient as care is continuing to be given. Okay, let's see. All right, so you're delegating these patients. Tell me, which one are you going to delegate to an RN, to an LPN, or to a UAP? So new patient with COPD for initial assessment, walking self-foot to ER, stable patient needing wound dressing day 3 post-op, stable patient 2 hours after surgery done under epidural, dementia patient with gait issues needing transfer to chair using gait belt, newly asthmatic diagnosed patient needing education on use of inhaler, stable patient needing catheterization. You have a minute. All right, let's see. So the new patient, always remember initial assessment, RN. Stable patient, wound dressing, day 3, LPN can do that. A stable patient 2 hours after surgery done under epidural, remember that is RN, because you really want to monitor this patient, how they're coming out of that and how they're managing after surgery. That is not a patient to delegate. Dementia patient with gait issues needing transfer to chair using gait belt, UAP can do that. Newly asthmatic diagnosed patient needing education on use of inhaler, RN, remember, Newly diagnosed, they need the initial education is your work to do. Stable patient needing catheterization, that is LPN. Okay, thank you. Visit House of Molly for more information. Bye-bye.